In certain countries, chiropractors are equivalent to medical doctors. They carry actually even doctorate title. Because I personally I would refer to a chiro, and sometimes they get surprised like, hey, you know what? The medical doctor referred to a chiro.
Yeah.
But this is the nuance of medicine that we need to embrace it.
So when it comes to chiropractic, a lot of people think that it's just, like you said, cracking the back, right? But I think a lot of people do not understand that or do not know until we educate them about that during the first visit, that a chiropractor's role is to remove misalignment so that your body and your nervous system can function at an optimal level.
Okay.
And your symptoms, like the pain that you're having, the pinched nerve sensation that you're having, are just a reaction to what's actually happening in the spine.
Okay.
Yeah, so we're not treating the symptoms, we are going back to the root cause and to remove those causes in the spine so that the symptoms will subside.
Medical field ni pancreatic cancer
bersama saya Dr. Roland Victor.
benda yang one of the worst stress can happen bila you makan tak sedap.
Doktor, saya punya culture kena makan nasi.
Zaman moden that every second of your life you either earn or learn.
Batu Medic Show. Okay, welcome everyone to another episode of Lesung Batu Medic Show with me, Dr. Roland, and today we're gonna speak about spine health. And I'm so happy to have first time in Lesung Batu a chiropractor, Stephanie.
Yeah.
Welcome to Lesung Batu Medic Show.
Thank you for having me.
Okay, so I want to get it start. So you're wearing two hats now.
Yes.
You are a chiropractor as
Yeah.
well as an entrepreneur. I
Yeah.
see there's a very interesting journey. But tell me how this all began.
Like when I first started my practice.
Why?
Okay. Of course, when I first came out, when I first graduated, I worked under another company, and then I decided to very boldly come out on my own during the year of COVID. So it's like 2020, right smack during
lockdown.
COVID. That's when I came out due to certain reasons. So I took it as an opportunity, even though it was a lockdown. Of course, costs are a little bit lesser as well. So we decided to start our own practice. I decided to start my own practice. And reason being because I want to build a team that has the same values, that carries the same vision to help people. Yeah, so that's why I came out on my own to start my practice.
So going back, you see, like Malaysia is very traditional when it comes to like choosing careers.
Okay.
So when you have this inclination towards like going into the health, allied health services or health services, they will say like, why you don't want to study medicine? Why you don't want to study pharmacy?
Yeah.
It's like more stable and stuff. And now like when we had like new universities like offering chiropractic masters or degree in chiropractic, why was that hunch like? What made you like think, okay, no, I want to be a chiropractor?
Yeah. So it all started, actually I almost enrolled into medicine. I went to the open day, I inquired everything, and I went home to decide about it. But sorry. So how it started is because I discovered that I myself have scoliosis.
Okay.
At the age of 19. So back then, my
That's
mom...
quite late, no, 19.
Yes, correct. Yeah. So, back then, I do see a chiropractor. My mom brought me to a chiropractor. And I think it's that first-hand experience that I get to go through. And then I was like, this is interesting. What if I can study this course to understand my own body better? Yeah. I mean, if all things fail and I don't become a chiropractor in the end, at least I get to know my condition better. That's how I was thinking back then. So I decided to speak to my chiropractor about like maybe a little bit more about the career and what does she do on a day-to-day basis and how is the education like. And then I just went for it.
So
like
you just like ditch medicine.
Well, because honestly, from medicine, I have to consider the years, the long years when it comes to specializing. I wanted to potentially be a pediatrician back then.
Okay.
So I know it's going to be a lot of years to invest into it. And I asked myself, can my passion carry myself so far? And back then when you are like 18, you just finish SVM. You finish A-levels. I don't know. It's very unknown for
Yeah,
me.
but it's good. At least you had like at least the chiropractor to at least like lean on and get some like forecast.
Insights, yeah.
Exactly. What's it going to be? What's it going to be like? So how was family's reaction when you said like no medicine but chiro?
Honestly, they were quite okay.
Oh, nice.
I'm surprised. Yeah, they were quite okay, and they were quite supportive. Of course, like this field is relatively new in Malaysia, but I think because they themselves, they do go to a chiropractor together with me. Yeah, they get treated as well. So I think that changes their mindset as well, that they are quite receptive about it.
So now they don't have to go anywhere, they come to you.
They get treatment at home.
So there's a lot of misconception.
Yeah.
Especially, I mean, as I know that in certain countries, chiropractors are equivalent to medical doctors. They actually carry actually even a doctorate title. I think in Canada, US, and I think they address that. Unfortunately, here we still struggle to comprehend that. But I wanted to explain that. What's the difference between when someone seeks advice from a chiro versus a physiotherapist? I mean, and then we have another jargon, the orthopedics coming in between.
Yeah.
So how, I mean, with your understanding and your experience, how can all of these people work together? Let's start with the first one first.
Yeah. So physios work a lot more on muscles and rehab. But coming from a chiropractor point of view, we work a lot. Our main focus is still removing the misalignments in the spine. Okay. And that is what a chiropractor's expertise is in. And so that is very different when it comes to like soft tissue therapy by a physiotherapist, rehab. Of course, we do cover those modules in our education as well. Yeah. And of course, when it comes to orthopedic, is the medical side of it. Yeah, when there's a fracture, I can't treat. I have to refer. You know, when there's potential red flags, we have to refer. So I see that actually all these field can actually work together rather than, you know, seemingly like a competition. It's more of a collaboration.
True.
If people were to see it that way.
But how often these days, like you are getting like referrals from an orthopedic specialist? Is it a struggle? Because I personally I would refer to a chiro, and sometimes they get surprised like, hey, you know what? The medical doctor referred to a chiro.
Yeah.
But this is the nuance of medicine that we need to embrace it.
Yeah.
Like sometimes someone is like having like a disc bulge. Maybe with some form of traction, whether by a physio or by a chiro, that they can sort this issue.
A lot of people come to us because they don't want to go through surgery and they want a second opinion about how they can try to recover from it without going through surgery. Yeah, but I would say nowadays, like my practice, we have been working a lot because I do see a lot of pregnant ladies as well. We work a lot with gynaes and also GP, medical doctors, that they would refer. Of course, for medical doctors, they will refer like back pain, neck pain, or headaches. But when it comes to gynae, they will also recommend that, hey, you know, why not you go and see a chiropractor for your back pain that has been occurring during your pregnancy. Yeah. Understand.
So that's a positive note. I mean, there's a lot of new referrals coming in. I mean, because there's some form of like trust touch point.
Yes, correct.
Because like last time, I think everybody's like, oh no, is chiro like another tita medicine? They're just gonna go and just like crack some joints and just like put the mic there and
that's the big misconception right there.
Exactly. So break that misconception to us. Even when I experienced chiropractic services, like I was expecting that.
Yeah.
I was expecting it, but it's actually no.
Yeah, so when you come in on your first visit, we would take a history of like your background and everything. We'll walk through the consultation first, and then we will carry out some physical examination and some orthopedic examination if it's needed, and also neuro examination to make sure things are functioning well. Okay. Again, like I said, if we catch any red flags or anything that is beyond our scope, we would have to refer. And if everything goes well and safe to treat, we would proceed with the treatment. Yeah. So when it comes to chiropractic, a lot of people think that it's just, like you said, cracking the back, right? But I think a lot of people do not understand that or do not know until we educate them about that during the first visit, that a chiropractor's role is to remove misalignment so that your body and your nervous system can function at an optimal level.
Okay.
And your symptoms, like the pain that you're having, the pinched nerve sensation that you're having, are just a reaction to what's actually happening in the spine.
Okay.
Yeah, so we're not treating the symptoms. We are going back to the root cause and to remove those causes in the spine so that the symptoms will subside.
Understand. So I think in our pre chat before we started our conversation, you did mention something about neurology.
Yep.
And many people don't know that the whole spine is actually having a lot of neurons, bundles, nerves coming through. And when you have an impingement or the setting or the alignment is not proper, then you're going to get some impingements. So how extensive that you all look into that? How you look into what? Posture, signs and symptoms, the
and
locomotion.
And also like which nerve, like so based on your symptoms, we would be able to tell which region that we need to look closely at, and then we'll go into thorough checking to see where is the misalignment. So a lot of like just some of the example, like that once we do some adjustment towards the spine, patients would say that they have lesser bloating.
Oh wow.
Yeah, and better sleep because of the parasympathetic and sympathetic dominance that we're trying to balance out. And also like let me think, bloating, quite a lot, headaches, like recurrent headaches non-stop, and constipation as well. Yeah, when we go down to the sacrum and check through. So there's a lot more things than just back pain and neck pain.
So it's interesting when you mentioned this, like how different is the segment of neurology that mainstream medicine studies and compared like what you all go through. It's something very I think you guys go to something more detailed in if you're mentioning this, because we are not trained to see like, okay, of course we know like certain root nerves are going to give you certain symptoms, but we're not looking into tapping all of this when we're even doing a physical examination.
Yeah, because when it comes to the misalignment, when we address it as well, we would actually check how is the direction of the spine that we need to like adjust. Okay. So it's not just like a crack like that. Yeah, the direction of it, we call it the line of drive, is also very important in order to restore that joint function, to take away that nerve impingement or that even that nerve, like stressing on that nerve. Okay. Yeah, that contributes to, let's say, bowel movement, your digestion. Yeah, some of them have better digestion after being adjusted. And then, like I said just now, also some of my patients, they really have trouble sleeping. They tried all sorts, they even tried taking pills, but it's just temporary solution, or some of it doesn't even help until they come to us. And when we check on like parasympathetic and sympathetic, so I'll tell them that, hey, you're probably under a lot of stress in terms of your nervous system. So today's adjustment is going to be very parasympathetic based. Of course, they do not understand what's parasympathetic, so I have to point out to them that we're going to adjust here and here. Okay. We're not going to touch anything in the middle because we don't want to drive the dominance of the sympathetic region anymore.
Understand.
So, and after 2 or 3 adjustments, most of them would come back and at least have some improvement. Okay. And some of it just resolve.
Okay. And we did mention earlier, like looking at one on your side, we're looking at the spine alignment and the adjustment, so that when you adjust the spine, technically you get all the nervous system also aligned. Yep. Then comes the physios. Okay. Physios would say like, the chiros come in, they do the alignment, but then the muscles are tight, and then this goes back to the same. So does that happen also? If you are adjusting the spine alignment, and some of them even go to other joints also. When that adjustment is done, if the muscles are very tense, can they go back to that awkward setting back again? Will that happen, or it will not happen?
You mean if they don't do any muscle work? Okay, because when the spinal alignment runs out of alignment, when the vertebrae runs out of alignment, it will cause the muscle to fire at a different different like
the
state.
AP state.
So by adjusting, a lot of times, like when we adjust the neck, yes, we do soft tissue release, but after we adjust, like example, the neck, and I recheck the muscle, patients themselves would also feel like, oh, it's different compared to like how it was just now. Of course, physios would still come in because in my practice we do have physios as well.
Okay.
They will come in to have a thorough muscle release because some of them can be having chronic pain.
Okay.
Yeah, that they do need both of these services together for better recovery for sure, and also rehab. Yeah, some of them could be sports injury that because we know ligaments heals very slow.
And then after the injury, they send to compensate on one side.
Yes,
or the other.
correct.
So
and
you have some hip displacement.
some of them want to go back to like sports again. So if you want to go back and compete again at that kind of level, you need rehab. It's not going to happen overnight.
So it's both are working into the physio and the chiro integration.
Yeah,
in your
actually,
center.
yes, I do see it that way.
Nice.
Yeah.
So with your practice at the moment, you have these two key medical skills, physios working together. That's fantastic because one's looking into the bones, one's looking into
the muscle and the rehab.
because they synergistically work there. So when did you start your practice? You said 5 years ago.
Yeah, coming 5 years.
and I heard that you have now moved into 2 outlets.
Yes.
Congratulations. So
Yeah.
how's it been like sometimes like when you entered into the segment like in like 2 years to 3 years, you said, I'm going solo. And now that there's also wearing 2 hats, the clinical cap as well as the
It's very tough.
entrepreneur cap.
Yeah, of course, there are a lot of hard lessons that I learned along the way because the school only trains you to be a clinician. The school did not train you to be an entrepreneur. And if you want to start your own practice, there's a lot of walls that I run into along the way that I had to seek help from coaches, mentors, people that are more experienced than me to help me out to see some of the blind spot that I do not see. Yeah, so I used to wear the clinical hat more than the entrepreneur hat, the business cap. Yeah, and in reality, that's not going to help your business to sustain. What more if you have a team under you? So as the team starts to grow, I saw that, hey, I need to do something about it. So I, of course, like I said just now, I went to seek help from coaches and mentors. And I think from last year end to about this year, that's when I start to balance out.
You got your
both of it.
sympathetic and parasympathetic balance now.
Yes, I had that. Yes, I need to balance them out. Yeah.
Because the medical side will always be the parasympathetic.
Yes, correct. And it's always like I'm a practitioner at heart. So, I would always be a practitioner first rather than a business person.
I think we all as clinicians I think suffer that. Even myself personally,
Yeah.
I think that journey is something that is always like I always feel it like a right struggle. You have to always wear the clinical cap first as heavy as you can rather than looking into the business.
Correct. Yeah.
But sometimes it doesn't pay the bills.
Correct, exactly. So I was like, no, I need help. I need to learn something about it.
How big has your team grown? How many chiropractors are there in your team at the moment?
Currently, we have 6 and 1 physio. Yeah. So the physio is relatively, new to our team as well. She just came on board, so it's fun working with her because she has also Pilates background. So she does use the Pilates reformer machine, correct, to help for the rehab. I find that really interesting because a lot of people have injury and they sign up for group classes in those fitness studio, and
they don't get
when
that
it's
much
1 to like
attention.
20 people, they don't get the attention, and also like they might get injured again, or like the injury might get worse.
Yeah, and I think the reformer is quite a good machine that it really allows you to go to that strength resistance.
Yes,
and
correct.
like really follow through that whole movement.
And it's not so tough because like there's spring, you can cater the spring according to the tension.
Exactly.
Yeah, because I went Pilates, but that's under fitness lah.
Understand.
Yeah.
Understand. So there's one unique segment that you guys are advocating, which is this thing called birth fit.
Oh, okay.
Yeah. So a lot of pregnant mothers, when they journey through pregnancy, whether it's their first pregnancy, where it's like they do not know the whole experience what they're going to encounter to whether it's like back pain and
especially
everything.
first time moms.
Yeah, and we see in our national system, the avocation is always like making sure that your iron is on point, making sure you eat, and making sure that the fetal growth is going to be right at each percentile and stuff, and then like journeying towards the last couple of weeks for delivery. But I realized that maybe a pregnant mother will rarely visit an orthopedician, or maybe even rarely go for physio because of this fear of like, oh, don't press this thing, don't touch this thing, kind of thing. So I see there's so much need in this because there are many women out there who are pregnant, whether it's first time, second time, or even they had an episode of a seizure, cesarean section and everything. They need the knowledge of to make sure that their spine is in good health. So,
definitely.
So I think what you are doing is fantastic, but I want to know more what you all are doing.
Yeah. So it was also when I first started, when I started my own practice, that's when I pivot into women's health, looking into the prenatal population, especially because, like you mentioned, I feel there is like the lack of like awareness in Malaysia in getting treatment when you are pregnant. I understand the fear that people would have. So normally in the first visit, I would assure them that, hey, the treatment that we're going to do is going to be very different from a normal individual. We're not going to put you in sideline position and adjust you because we don't want to create torsion in the uterine. So we would have other techniques that is specially catered for pregnant ladies, and we were going to perform that technique on you. And most of the time when they see the equipment that we're going to use, like a belly pillow for them to lie face down, those kind of things, they get more like less nervous and less fearful about it, because like, oh, okay. Oh, and most of the time, like when we go through the treatment, they'll be like, oh, that's all? Oh, that's the force that you're going to use? I'm like, yeah, and that is enough.
I see.
Yeah, because we, especially pregnant ladies, we're going to focus a lot on their soft tissue. So their muscle, their ligaments, we're going to focus a lot on that because all those carries like the weight of the tummy. And having that good pelvic alignment would help baby to have a good space to be in, because I also see a lot of cases that baby is breech. And again, we're going to highlight that I do not turn babies. That's not my scope. But what I do is to balance your pelvic, your muscles and your ligaments to provide that optimum space for baby.
I see. And even that will help even delivery as well.
Correct. Yeah. And babies would turn down innately. I don't have to do anything. So what I do as my role as a prenatal chiropractor is to balance things out, making sure your nervous system is functioning well, and everything will just fall into place and follow accordingly.
And how often has a mom to go through this? I mean, how often would they see you? Even I'm talking about someone who maybe doesn't have any problem.
Okay.
Who just want to make sure that, you know what, I want to have this good pregnancy journey.
Yeah.
A safe pregnancy journey, that I don't want like in between, maybe in my 7th month, and then it's something that is lurking slowly, and then the pain is coming off, and all that suddenly it's like when the baby starts to have a good vertical growth, and then the weight growth, and then 7 months having back pain. So how often would someone, like maybe a healthy female, the right age, like seek this kind of advice?
When moms come in at like week 36, 37, I'm like, why didn't
so
you
late?
come in earlier? You know, I have only like a few more weeks to work with you. I have a lot of patients that actually see me even before pregnancy, and they come in and tell me like, okay, now I'm pregnant. And then we just like, okay, let's hop on to this treatment that is for pregnant ladies. So typically, if like you say there's no pain, I would see them once 2 to 3 weeks for a check-in, just like how they would normally check in for their adjustment as well. But if there is certain things that we're going to address, there's some pain and some issues that's going on, then I definitely need to see them a little bit more often.
How often is it?
It can be once a week.
Once a week. Okay.
In very serious cases, maybe we'll amp up to twice a week.
I see.
Yeah, but once things subside and things get better, I'm just going to bring it down to once a week, and then slowly once every 2 weeks. And then I'm going to bring back up when it's nearer to their due date.
I see.
Yeah, because in that few weeks, things changes very quickly. They would definitely feel the weight of baby, like, suddenly like it's so heavy.
I got a funny question. Has anyone broke their water bag during?
Oh, not yet. Hopefully not, but not yet. Yeah. But I have a patient that she delivered right after she saw me.
Oh, wow.
Yeah, so she came in for her session and then she went back. And next thing I know, she's like, I have to cancel my next appointment. I delivered. I'm like,
Oh, great.
Oh, okay. Yeah.
So that's nice. And usually at one session, how long will a session last? Because sometimes the perception of like chiro, physio is like this massage session. Because based on my experience, the session is pretty quick session.
Yeah. For my practice, it's within 30 minutes. Yeah. But for prenatal cases, because sometimes there's a lot of things that we need to work on, it can be like 30 to 35 minutes. But if it's just that there's no major things that we're going to address that day, it's just checking in back for a follow-up, then I would say about 20 minutes, 25 minutes. Yeah, within 30
like
mines.
About within 25
for follow-ups.
Follow-ups, right? And what would what would something like this cost like? Is it a package or they walk in?
Okay. In my practice, we do offer single session as well as packages. And a lot of them, like once they understand that they actually need this for like quite a few sessions, they would most of the time hop onto the package because you save more.
Save money.
Yeah. So the single session is there for people who are like, maybe they are claiming so they can't do a package, or they are international or tourists. They are not based here, so they can't commit to a package, and we totally understand that. So they just have to know that there is a price difference, and if they're okay with that, then...
And what's something like this range from 150 to 300 ringgit or lesser than that?
Oh, if it's just chiro adjustment, our price range is within... You mean even with packages, it can go as low as 110, some of the bigger packages.
I see.
Yeah, and single session ranges about 160 to 180.
Oh, okay. That's pretty...
It's pretty fair, yeah.
Affordable. Yeah, so there are interesting things I think this year that happened is like now the government has gone into this traditional complementary medicine. So I think chiropractic services fall under complementary medicine. So how do you see it? I see it as a good thing because now they have like acknowledged and now started hugging all the other allied medical sciences to bring it together in order to make them sort of like legally in terms of the health facility of the country. So now chiropractors has to be registered as an
under KKM.
Under KKM. So that's a good thing. And we see more and more centers being opened. So that means there are more chiros coming out, which is a good thing. But yet, competition is a good competition. But I think once there are more centers, there are more awareness happening. I think more and more people are going to seek services.
I feel like it's like a beam when there's like more centers coming out. People will definitely see like, oh, there's another chiropractic center. Oh, another chiropractic center. Then the awareness will go up. So it will always be a beam that, like this. That's how I see it rather than like, competition. Because I think in KL it's relatively saturated. But if you look at other states in Malaysia, there's still a need there. Yeah.
So are you planning to explore other states?
If there is a chance, but not at the moment. Yeah. There's a lot of work to do if I were to go into other states.
The other thing I wanted to ask you is also, you have quite a following on Instagram. It's growing. Good. So, is there a pressure creating content?
I think not at the moment because I just put out what I do and what I want people to know about. And I just leave it there.
Okay, good. I think that's just like exploring and just being honest with whatever happens in the practice.
Yeah, maybe I'll get scared when it's like 30K, rather than like now. But no, I think I'm.
No, you'll get there. You'll get there. With you see there's a growth. There's a growth in the women's segment. There's a growth in especially with kids. Also, I see a lot of kids with we see the concern of ADHD, autistic, and everything. Autism. So this kind of setting their nervous system is going to be one thing.
Yeah.
So sometimes a lot of parents just feel it's like, it's going to be just a bone alignment. Or the bone alignment comes with the alignment of the neurological system as well. So we're seeing whether the tippy toes are happening, it's reduced, whether they are being showing any tantrums and more calm, because all of this firing of signals is affecting their response. So last but not least, before we wrap up, anything that you want to say to the public, where how to look at it differently today and embrace the diversity of medicine that we have?
I think misconception happens when people do not have enough knowledge for that thing. So why a lot of misconception was around chiropractic previously is because not a lot of people understand, like you mentioned, people just think, coming in for a crack and then chop, you're done, you kind of thing. But then after that, when you actually experience it, you're like, they actually walk through a thorough consultation. They actually do examination before they carry out the treatment. They actually explain things to you, and even patient education as well. So I think when people understand that, then they know that it's not just merely about back pain and neck pain. And when they understand that their nervous system has to function at an optimal level for them to be healthy and to also achieve wellness, then a lot of this concept will just change their mindset towards chiropractic.
Is there just a few more since I missed that? Is there any association for chiropractors in Malaysia?
There is. Yeah.
How long has that been? Is it recently or?
No. It's quite a while.
Oh, so that's good. So at least there is a form of association to get
correct.
more advocacy on how the whole of chiropractic medicine works. And where do people reach you out? Where's your practice? Please share.
Okay, so we have one in Sunway Geo.
Okay.
And the second one in Alpha Bangsa. So one in Subang, one in KL Bangsa.
Okay.
And if you want to contact us, you can either reach me via my Instagram or you can head to Spine Plus. That's my brand name. And you can just drop us a DM and the team will assist you from there through, let's say, WhatsApp or even just through DM itself. They will see what inquiry that you're having.
Okay, great. So Spine Plus is the place to go and look for Stephanie. Okay, so thank you so much for coming to Lesung Batu Medic Show. And until we see you the next round, kita lesung kau.